Knock knee is also called as genu valgum, which is a deformity in which if a person stands with the legs together, the knees will be touching each other completely, or else the legs would be moved inwards, but the feet will stay apart. Now, this is a type of structure which is commonly seen in kids, younger kids, but as they grow up, it automatically gets corrected. But sometimes knock knees can be pathological and could be seen in older kids as well as in elderly or else adults. At that time, it is something which is called as a pathological knock knee, which requires medical intervention. So now, why does pathological knock knees basically happen? Pathological knock knees mostly happen due to neurological conditions such as cerebral palsy or spastic diplegia, spina bifida, which is mostly due to the altered muscle pull or spasticity which misaligns the entire structure of the body. The second reason of getting genu valgum or else knock knee is bone disease following poor mineralization, for example rickets. This is also a common problem seen in kids, but here it's not normal but due to pathological problem where deficiency is the reason. Even the people who have got short stature or else if their bones are smaller, then also they will show this deformity. In conditions where there is bony malalignment either due to birth or else due to some other issues, at that time this joint misalignment lead to this problem. Skeletal dysplasia is also a condition or else a problem which could lead to knock knees. People with metabolic bone disorders as well as obese people are at higher risk of developing knock knees. Even knock knees is commonly seen, especially in women, that too who are having problem of osteoarthritis. As first place, the structure of women is designed in a way where the valgum or else this angle at which the femur bone or else the hip bone is aligned with the leg bone is in a way that the knee come in the center or else are closer compared to men. That too, when osteoarthritis happens, where there is a lack of joint space, lack of joint fluid, this problem further increases and the problem of knock knee becomes very evident. So now, what is the solution for it? Now, as I said, knock knees can be seen in normal situations also if it doesn't hinder your activity of daily living. Even if you have got flat foot, at that time also you are at higher chances of developing knock knees. So now let's understand how you can manage knock knees. Now, sometimes knock knee doesn't require any management if it is mild, if it do not affect your activity of daily living, if it doesn't cause any kind of knee problem or else knee pain, and if this is something which is a developmental thing seen in kids. But if knock knee is something due to a pathological condition, then you might need intervention. And intervention is mostly with the help of corrective belts, where the alignment of knee is corrected with the help of the belt that you wear externally, with the help of exercises, and if it becomes very severe, then surgical management of aligning it back can be done. Now let's have a look what are the exercises that you can do in order to correct or else prevent further worsening of knock knee problem. So let's begin. So friends, this is how you can do exercises for knock knees. I hope you found this video helpful. If yes, make sure to like this video, share this video, and do not forget to subscribe to HealthQ channel for more such health information related videos. I'll see you in another video. Thank you.